All right, thanks, Brett. Afternoon, everyone. Thanks for taking time to hop on our weekly update call. Just like usual, we'll go ahead and start with a review of the data. So Jordan, if you want to take it.
All right, hopefully everyone is seeing my screen. So this is the MySafe Start data, and all of our counties besides Crawford are still in the E risk level. But for both our overall daily cases per million and percent positivity, those continue to trend downward. And cases have been decreasing in all 10 of our counties, as are the percentages of positive tests. So we have seen a 19% decrease in cases when we compare this week to last week. So the decrease is not as extreme as was reported to you last time, but is still a decrease, so that's a good thing. The cases we saw in the past week were identified as household and community contact, school, including colleges and sports testing, daycare, recent travel, and worksite exposure. Our total number of jurisdiction-wide cases as of yesterday at 3 o'clock was 18,678. And cases by county as of yesterday are Crawford with 880, Kalkaska 996, Lake 551, Manistee 1,076, Mason 1,918, Mecosta 2,858, with Ferris State reporting 733 cases, Misaki 1,200, Newaygo 4,241, Oceana 2,516, and Wexford 2,442. In the past week, there were 12 deaths reported to us and 907 people that recovered. Yesterday, there were 10 positive inpatient cases at Munson Healthcare Cadillac, 8 at Munson Grayling, 3 at Munson Manistee, 12 at Spectrum Health Big Rapids, 9 at Spectrum Health Gerber Memorial, and 9 at Spectrum Health Ludington. And then next I'll switch to our vaccine table. As of today, 50.9% of the state has initiated their vaccine series, and for the next part of the My Vac to Normal plan, we need to be at 55%. So since last week we increased about 2%, so if it keeps going at that rate, then we should reach 55% in about 2 weeks or so. So here you can see our vaccine totals administered as of Sunday, May 2nd. So in the blue is the DHD number 10. So we have administered just over 92,000 doses. And then in our 10 counties, 82,035 people have completed their vaccine series overall. And then also on this tab, I included the table that I showed you last time. So this is the percent of residents that have completed their vaccination series as of May 2nd, which is that Sunday, by age group and by county. And you can kind of see how all 10 of our counties are doing comparatively to each other. Does anyone have any questions?
All right. Thanks, Jordan. And we will send this information out to everybody after today's call so that you have it. As Jordan indicated, we're starting to see decreases in the metrics that we're monitoring and the number of cases that we're seeing. Our priority continues to be vaccinations. At this point, trying to get shots in arms. Some additional things that have come out this past week, well, the end of last week and into this week, there was the release of the My Vac to Normal plan, which is kind of the outline of a plan for us to get out from underneath the epidemic orders. That's really based on vaccination percentages, and Jordan had alluded to some of that. It's a 4-step process. So the first step, and I may have shared this last week, and if I did, I apologize, but I wanted to kind of cover it. I wanted to cover it again this week. The first step involves once we have reached 55% of those eligible to be vaccinated, and right now eligibility is that 16 and up group. Once we've reached 55% of those eligible having received their first dose of vaccine, so it's not completely vaccinated, but have gotten their first dose of vaccine. Once we reach that 55% mark, then 2 weeks later, we would they would lift the requirements for working from home at that point, and so employers would have their employees back in the office. Step 2 is 2 weeks after we've reached 60% of the eligible population, which again is 16 and up, having got their first shot. 2 weeks after that, then we would see an increase in indoor capacity at sports arenas, conference centers, banquet halls, and funeral homes, increasing them up to 25%, increased capacity limits at gyms up to 50%, and then lifting of the curfew on bars and restaurants, and that would be at that 60% mark. The third step is when we reach 65% of the eligible population having their first, getting their first vaccination 2 weeks later, all indoor capacity limits. We still would require social distancing, but all of the indoor capacity limits would be lifted, and there would be some further relaxing of the guidance on residential social gatherings. And then step 4 would be 2 weeks after we've hit the 70% mark of those eligible to receive their first dose of a vaccine. Then all gatherings and face masks orders would be pulled back at that time, with the exception of there still might be some masking requirements for some larger indoor type events, but for the most part, they would all be gone. Now, there are some little caveats built in there so that if you get to step 1 or you get to step 2, and then we see, cases per million or positivity rate surge back up, it's not as if we would go backwards, but we just may not move on to the next step, to the step 3 and subsequently to step 4. So that is the plan that is out there right now. Again, hinges entirely on vaccination rates. And so working to try and get individuals vaccinated as quickly as we can. There has been additional guidance put out for those individuals that are considered to be fully vaccinated, added to this guidance. So fully vaccinated is going to be defined as being 2 or more weeks since you've received your second shot of a two-shot series, or 2 weeks or more since you've received your 1 shot in a single shot series. So once you're fully vaccinated, some of these are old, some of these are new, but the older ones you are able to visit with fully vaccinated people indoors without having to wear masks or physical distancing. Visit with unvaccinated people, including children from a single household who are at low risk for severe COVID-19 disease indoors without wearing masks or physical distancing. This is a new one, would be you're able to participate in outdoor activities and recreation without a mask, except in certain crowded settings and venues. You're able to resume domestic travel and refrain from the testing requirements that have been put in place for travel. You also would not have to self-quarantine after travel if you're fully vaccinated. You would be able to refrain from testing if you're flying internationally or traveling internationally, unless the location you're going to still requires you to be tested. But on the part of the United States, or in Michigan at least, you would not have to do that. Refrain from testing following a known exposure. If you're asymptomatic, that's an older one. Refrain from quarantine following a known exposure. Again, that was one of the original ones out there, if someone is fully vaccinated. And then the last one, and this one probably has more of an impact on school kids, but those involved in testing for sports or recreational type activities, if you're fully vaccinated, you'd be able to refrain from the routine screening or testing as long as you remain asymptomatic. So those are just some of the other incentive type things that have been put in place to try to encourage individuals to get vaccinated. Internally, as part of the health department, we have we are in the process, actually beginning this week, of making a pivot away from our large in-house vaccination clinics. Not that we're going to be stopping offering those clinics, but we really are going to, Tuesdays being the only day we'll do clinics in-house. Potentially Friday for second doses, but for the most part, our first dose clinics, Tuesday would be the only day we'd be doing them in-house. And then the rest of the week, we're going to be pivoting more to out-county population-specific type clinics, recognizing that the people that were coming into our office to get vaccinated were those that were highly motivated to get vaccinated. They wanted to get vaccinated, and we've gotten most, if not all, of those individuals. So now we need to pivot to more that middle group, the fence sitters who, they'll get vaccinated because it's convenient for them. So we'll go to where they are, hoping to get them vaccinated. So these will be smaller type clinics. We might only see 25, 30, maybe 50 people at these, but still we will go there trying to get those people vaccinated, recognizing that might be 25 or 50 or 30 people that they were not going to come into our office to get vaccinated. So we're going to go to where they are. We also are making the pivot to now allow walk-ins to come into our office and be vaccinated. Originally we tried to get appointments scheduled because our concern had to do with, the fear of wasting vaccine. And again, now we are moving away from that fear and really more to the point of just, if people want to get vaccinated, we're going to vaccinate them. And so if we have 1 or 2 or 3 people that want to get vaccinated, we're going to vaccinate them, and then we'll worry about, can we find others to use the vaccine on after that. We know if we make people wait a day or 2 to get vaccinated to come back to a scheduled clinic, they're most likely not going to come back. And so it's more important that we get our vaccine into arms versus having it sit in our freezers. So those are some of the changes that we are looking at making. In addition to walk-ins, we also are making available all 3 of the different varieties of vaccine that we have. So Tuesday, when somebody comes into our clinic to be vaccinated, they'll be offered the choice of Pfizer, Moderna, or Johnson & Johnson, and the vaccine that they want will be the vaccine that they will get, and then we'll schedule second dose clinics appropriately. To some extent, we'll be doing this at our out county or those population specific clinics that we have, but that'll really be determined by how much vaccine we have and what the preference of the group that we're setting the clinic up with may feel that they're going to want. Related to vaccine, I did mention that the eligible population right now is 16 and up. We do anticipate, and it's expected, that this coming weekend, Pfizer will receive a EUA, emergency use authorization, to begin using its vaccine on 12-year-olds and up. And so we have been in communication with our schools, reaching out to them and seeing if they are interested in having on-site school clinics. Some of our schools, we already have adolescent health centers there where we have providers and we have staff on site at the schools. So any vaccination that we do will be done through those. In the schools where we don't, we'll be looking to partner with the school or with maybe some other community entities to try and offer those clinics to individuals there. So again, we do anticipate or expect that EUA will be provided this weekend, and so looking next week to move more into beginning to vaccinate that 12 and up population. Now, with the MyVac to Normal plan, we're unsure of when the 12-year-olds can begin to get vaccinated. If those individuals will also count into that denominator to get to that percentage, or if it'll still remain 16 and up. That's something that we're going to kind of have to wait and see on. I've heard conflicting communication related to that, but more and more, basically what you're seeing is for those individuals that are fully vaccinated, you're seeing more allowances being made for them to go about without necessarily having to wear masks or social distance in certain settings. So In addition to that, there was an update made to the masking and gathering order as of yesterday, went into effect today, and it will be in effect through, I think, the 31st of May it runs to. Basically everything was the same with the exception of some increased capacity limits that have been allowed, and some other masking restrictions that were lifted. So some of the key pieces in the new order are masks are not required outdoors unless a gathering has over 100 individuals. Masks are not required for fully vaccinated individuals at residential gatherings, which I had already mentioned earlier. Masks are not going to be required during active practice and competition for non-contact sports that are played outside. So an example of that would be if you're playing baseball or softball, you would not have to wear a mask when you're in the field or at bat, but if you're in the dugout where it's more congested, then you would have to wear a mask at that time. But while you're actually engaged in the sport out in the field, you would not have to wear a mask. Larger outdoor events like fairs and festivals or golf tournaments that follow enhanced mitigation measures that really involved disinfecting and social distancing and some other requirements. These were provided earlier on. They're permitted to have 20 people per 1,000 square feet with no cap. So depending upon the amount of space there may be available, that's the formula that they would be using for that. Residential gatherings can go beyond the current cap of 50 individuals. So if you've got a big backyard and you can space people out, then you can exceed that 50 individuals and you can go to 20 people per 1,000 square feet. And then for some of the outdoor stadiums with fixed seatings, their capacity limits also have been increased for stadiums or arenas with fixed seating capacity of 5,000 or greater. You're able to go from 750 participants up to 1,000 participants. So the capacity limitations will help. The easing of those capacity limitations are going to help with some of our schools related to having outdoor graduation type ceremonies. So that is a good thing. And I know we've been in communication with some of our schools already on what some of those limits might be. So those are some of the updates from this past week to the orders, the epidemic orders, as well as some of the pieces that are now in place as a result of being fully vaccinated. As I said, we have made a pivot to moving from in-house clinics, vaccination clinics, to more outdoor clinics or out-county type clinics, utilizing our mobile unit. So you will be seeing our mobile health clinic out and about in the community. We did begin to use that this past Wednesday. We were actually out in Mesick at the Mesick Mushroom Festival, vaccinating the carnival workers that are there. This is actually part of a collaborative effort between us and the Health Department of Northwest Michigan. So we provided the first dose of vaccine to the workers, and then when it's time for their second dose, they will actually, be at an event that'll be up in their jurisdiction. So they'll be providing the second dose to them. While we were there, we were able to arrange with those folks and extend an offer to come back and actually be at the actual mushroom festival on Saturday for a couple hours. So we're going to actually be offering vaccine on site at the Mesick Mushroom Festival this Saturday for a couple hours. I'm not sure. Might be from 9 until 10 or from 9 until noon. It could be from 10 until 2. I'm not quite sure what the time frame is going to be for that. Next week, we are planning to be on Wednesday at Martin Marietta and Manistee to host a clinic. And then on Saturday, there is an event in Newaygo County, I believe a hazardous waste drop-off at the Road Commission that we will be at for a little bit, offering vaccinations to anyone. You don't need to have an appointment. So if someone's interested or they're dropping their stuff off and we're there and they want to get vaccinated, we'll make it real easy for them to do that. In the afternoon that day, I'm not sure if we're going to head up to Baldwin to the blessing of the bike ceremony, or if we'll wait and go there on Sunday. But that will be another festival that we are planning to be at. So in addition to these population specific and out county type events, we're also looking at working with some of the various festivals or other events that are already scheduled in the community where community members may be at. And if we go there and make it convenient for people, that may help them choose to get vaccinated. So those are some of the things that we're looking at moving forward with related to vaccinations. So I think that's everything that I have to share today. I don't know, Brett or Jordan, if you guys have anything else to share. If not, we can go to questions.
I don't have anything else.
Nothing for me.
Okay. Anyone have any questions? Let's see. Looks like one, can individuals that have received a first dose elsewhere now come to your clinic, walk in for a second dose? Yes, they can. So individuals who have received a first dose of vaccine elsewhere, they can come into one of our clinics, either our first dose clinic on Tuesday. It's easiest if they come into one of our scheduled first dose clinics on Tuesday or our second dose clinics on Friday and be vaccinated. But yes, we will vaccinate them if they need to get their second dose. So we will do that. Other questions? No. All right. Well, that's the information that I have to share today. If there are no other questions, we'll plan on getting together again next Thursday at 3 o'clock. Unless for some reason we need to, reconvene as a group to share information with you before that. Otherwise, we will, like I said, we'll plan to talk next Thursday, kind of be watching for our new mobile health unit out in the community. Logistically, we're trying to figure out how we can get it around to all 10 counties, but we'll make that happen. If you hear of individuals who want to get vaccinated, yes, there are multiple locations in a community where they can get that done. Keep us in mind. We do, as I said, we will do walk-ins, and we'll do what it takes to get somebody vaccinated if they're interested in getting vaccinated. So, having said that, if there are no other questions, that's all I have, guys. Have a good weekend, and we will talk with you next week.